See all of y'all. Good to start another year and be back. So welcome, welcome. We will convene this afternoon's hearing of the subcommittee on human resources for appropriations. We've got a couple of new members, and I thought just as we get started here, why don't I let everybody introduce themselves just quickly, tell where you're from. We'll start with you, Bubba, and just go around.
Bubba Epps, House District 140, with all of Twiggs, Wilson, Blakely, parts of Bibb, Jones, Houston, and Lawrence.
Does that leave anything for the rest of us? Buddy Harden, District 148, have Crisp, Wilcox, Pulaski, and part of Houston counties.
Buzz Brockway, District 102. I have a small part of Gwinnett County.
Calvin Hill, now District 22, have been District 21 and District 16, and I've never moved. But that's the way it goes. But that's part of Cherokee, Forsyth, and North Fulton counties.
And we have a few more members that may be coming in at times. I'm Katie Dempsey. I represent Rome and a little bit of Floyd County, District 13. And this is Sarah Dunn, who really knows how to do this. She's our budget analyst. So thank you for being here, Sarah, and for helping us. We're going to start off, first of all, with the Department of Behavioral Health. I believe Commissioner Berry, will you be doing that? Welcome. It's good to see you.
And if this is that working? I think so. Okay. Madam Chair, thank you very much for the opportunity again to speak to you today, and distinguished members of the committee, thank you also for the opportunity. The Department of Behavioral Health and Developmental Disabilities was created about 3 years ago. It was part of a total restructuring of the Department of Human Resources with the intent to give people with behavioral health challenges, people with developmental disabilities, and people with addictive disease their own department, so that more emphasis could be placed on helping them live a life of recovery and independence. And it is an absolute honor to be in a position of leading this agency at this time. I know that Commissioner Reese and Cook and Owens and Fitzgerald will be speaking with you at some point. And while they're not in the room, I'll say I don't feel there's any more important work than the work that our department does. And I'm proud to be working with our team that is here and may be called on to answer some of our questions. I've been on the job for about 6 months, so I've learned a tremendous amount of, seen and learned a tremendous amount of information, and it has been a remarkable, remarkable time. I have valued the time that I've gotten to spend with many of you and other representatives and senators as I've traveled the state. I've seen wonderful things that have been delivered to the people that we're supposed to be caring for, and it has been a remarkable experience. Our department, and I know I spoke about some of this during the Joint Appropriations Committee, our department is responsible for two major areas. One of the largest one that a lot of people think that is the majority of the work we do is hospital-based services. We run 6 state hospitals, or 6 state institutions, and historically one of which is about 180 years old, and that's Central State Hospital. And then we have things that have been put in place almost every couple of years since then. So the hospital system makes up a significant portion of the work that we do. However, the community work that we do is even larger than that, and that's where more of our attention needs to be given, because we serve, believe it or not, only about 7,000, a little over 7,000 people in the state institutions, but we serve almost 200,000 people in the community. And that's a lot of people who need services, and I think we can do a much better job of serving even more, and that will ultimately be our goal. The other big goal that we have is to make our system easier to access for people. So people that are having challenges with either addiction issues, developmental disability issues, or people with significant mental health issues, we feel very, very strongly that it is our job to hold our providers accountable so that people can have easy access to high quality services. So we'll be focusing on that. And we do that in a couple of different ways. Inside our department, we work as a team. And outside of the department, we work in partnerships with our providers. We are only as good as our provider network is. So there's a lot riding on our provider network, and we're holding them more accountable and expecting more of them than we ever have in the past. And there's some very significant reasons for that. About 3 years ago, Georgia entered into a settlement agreement with the Department of Justice. The settlement agreement came about, and many of you may know this, the settlement agreement came about because of some significant challenges that we were faced with in the state hospitals. There were people that were dying untimely deaths, a 13-year-old girl who complained of a stomach ache for over 3 days. Finally, by the time they got her to a doctor, she died of an obstructed bowel. That was just one of many things that were happening in our state hospital system that caused the Department of Justice to come into Georgia and look at the conditions that we were dealing with, and ultimately Governor Perdue signing a settlement agreement with the Department of Justice that in essence we would move a large number of people out of the state institutions and develop and build communities so that they can be housed in the community rather than in institutions. We did a run of that up in Rome, and we closed a state hospital up in Rome, and we did our best to build that community, but I don't think we did an adequate enough job. So Rome has been one of our learning laboratories of how we do a better job of building communities. So you'll hear us talk a lot about, over the next several weeks and months, you'll hear us talk a lot about our number one priority has to be to build communities. It's not about closing hospitals, it's about building communities. And that's the primary focus of our department. On the developmental disability side, I want to remind everybody that over the next 3 years, 2.5 to 3 years, by 2015, the state is required to move out 150 people with significant developmental disabilities a year into the community. And that's part of the settlement agreement. So ultimately, there will be no people with significant developmental disabilities in our state institutions. They will be living in the community, in their own homes, with their own pillow, on their own bed, not in a state institution. It's a challenge. It is a very, very, very heavy lift for us to do, but it's the right thing to do. The settlement agreement certainly does not say close hospitals. The settlement agreement says move these people out of the hospital and give them the opportunity to live a life in the community. So we'll be focusing on that. I also want to remind everybody that we have another settlement agreement with the Department of Justice. And that has to do, again, with the conditions in the state hospitals, specifically as it related to youth, client-on-client assaults and staff-on-client assaults and client-to-staff assaults. And that's called the CRIPA lawsuit. And that's a civil rights lawsuit that in essence said you will clean up the conditions in your state institutions. So for those hospitals, this was prior to the settlement agreement. So for those hospitals that we were running, we absolutely had to clean those up as well. So that's 2 lawsuits that we're dealing with. And I think Dr. Lee, who is here, he's over our developmental disability services and also oversees and has been overseeing our hospitals, has been leading that. We are very, very, very close to being in compliance with the CRIPA settlement agreement. And what we have to do now is ask to give us our last year of monitoring, and we're hopeful that by the end of this upcoming calendar year, we will be out of the CRIPA lawsuit. That's another big lift. And I think, again, the third one that we're dealing with was this small one that only impacted the whole country, and that was the Olmstead decision. And the Olmstead decision, in essence, said, and that was started here in Georgia under Commissioner Olmstead almost 20 years ago, and that, in essence, said that if you are a person who has been living in an institution and you have been determined to be appropriate for community-based services, it is illegal and against your civil rights to be kept in a state institution. That's an overarching settlement with the Supreme Court decision that focuses our work on delivering community-based care. And Karina Mageland is here from the Ombudsman Office, out of the Governor's Office, and our partnership with them is very strong so that we can work together to help people live a life, again, of recovery and independence. So we're very pleased with that. Our budget, and we can certainly answer many questions or as many questions as you have. Our goal If you remember last year, we had significant challenges with the developmental disability service delivery system. And our goal when I started 6 months ago, and my commitment to our board of directors, was that that would be our number one priority of getting that in a better place. And I'm so pleased to see that Dr. Lee has gotten it out of a crisis situation. Now, the challenge that we have is that we have moved almost 450 people who had historically not been on a Medicaid waiver onto a waiver, and they are now getting the services that they deserve in the community. That's been a remarkable lift. There's another 250 plus people that have been living in the community that are now getting support on waivers as well and getting state dollars, combination of state dollars. So that was our number one priority, was to get developmental disabilities out of the crisis state that it was in, and I think we're probably 75% of the way there. The other challenge that we had was that the providers, it was an us versus them. The providers felt like it was them versus the state of Georgia. And what we felt very strongly about was we needed to make certain that we were doing everything we can to support our providers. Make it easier for them to become providers, make it easier for them to get paid, make it easier, reduce the amount of audits that we were doing and things like that. And we're in the process of doing a better job with that. And then from an internal departmental goal, one of our goals was to try to earn the respect and confidence of our other state departments and from you all. And I feel like the team that we're putting in place now is a very, very strong team that you will ultimately have confidence in, that the information that you get, the numbers, the data, the dollars are good, clean information, and that ultimately you will be as proud of the department as I am. So I wanted to get into a little bit of the discussion on the numbers. And again, we were indeed impacted by the 3% budget cut. However, as many of you know, the settlement agreement dollars are not subject to the 3% cut. That's part of our agreement, again, with the Department of Justice, and Governor Deal has been very, very supportive of making certain that he supports the department in regards to the settlement agreement, with one of his number one priorities being to get out of the settlement agreement. So when you take away the settlement agreement dollars, the 3% cut really impacted our department more in a way of a 5% cut. We really went down the path and tried everything possible to not cut providers. So in 2013, we were absolutely able to do that. We had state dollars that we were, and one-time federal dollars, what are called upper payment limit dollars, that historically have come to the hospitals to be able to offset the cut to the providers. And when I say providers, it's not necessarily the providers that we were so worried about. It's the clients that receive the services from those providers, that we did not want to cut services to the population that we're supposed to be serving. Our system, other than the settlement agreement dollars, which I can't thank you enough for continuing to support, the system as a whole has been an underfunded system for many years. I think that's part of the national dialogue that's going on now. For 100 years, everybody didn't really pay a whole lot of attention to mental health at the national level. Over the last 2 months, some of the national tragedies have certainly opened dialogue in the behavioral health arena that we never thought would come about. And so the system as a whole, our core services, those are services that are not necessarily at the crisis level, but services such as if you needed an individual therapy appointment or a day service type of a program, case management, medication evaluation, psychiatric evaluation, it sometimes takes people 6 to 8 weeks in order to access that service. And the bottom line is our core infrastructure is underfunded. And that's not a state of Georgia issue, that's a national issue. I've been asked over the last couple days, do you have enough money? The answer is no, but we certainly want to work cooperatively with you all, and again, the support you have given is tremendous, but I will say that as the economy starts to turn around, don't forget about us, because we're a key instrumental piece of the fabric of Georgia, and without us there'll be a lot of people who will be accessing emergency departments, who will be accessing sheriff's departments, homeless shelters and things like that, and I think we can do better. When you look at the numbers on page 7, and what we decided to do, and I hope this is acceptable, was we clumped things together so that you could get an overall picture. We can certainly, and Jeff and Lee are here and Chris are here, we can certainly get into more detail if needed. But you can see on the common changes statewide, the property liability premiums. These are just basic things that you'll see where we were able to capture those dollars, and we can get into any questions you have about that. If you go to page number 8, these again are things that between OPB, and I also want to recognize the strong partnership we have with the Governor's Office of Planning and Budget. Both Teresa and her staff have just been phenomenal to work with, and it's been a real pleasure to work with them as well, and we appreciate their support and guidance. But you can see how this impacts the agency, and again, if we have specific questions about that, we can certainly answer them. This next one on page number 9, I want to talk just a little bit about, because it can get a little bit challenging to understand. What the CRIPA lawsuit said was that we had many people in the hospitals, and this is really just a realignment. When we talk about the CRIPA lawsuit, many people were going or having a variety of doctors come onto the different units that we run, and nursing staff and everything. What the CRIPA agreement allowed us to do was develop what we call treatment malls. And so this is shifting dollars, in essence, that were on a specific unit into the treatment mall, so that then you're giving people who are in an institution the opportunity to go out of their units and get, one, exercise, two, be able to be a little bit mobile. It's still on the hospital grounds, but where you go and you get all of your services in one location. So it was realigning where those dollars were targeted on a unit to make it a treatment mall. And it's been very successful. People, there's a way for them then to increase socialization skills and get their services all met in one location rather than just doctors going from place to place. The other big one, if you go to page number 10, and again, these are hospital expenditures. So I want you to remember that the settlement agreement requires us to move people specifically with developmental disability, and many people also with significant behavioral health challenges, out into the community. What we're finding is that as we do that, we're able now to look at the overall units on the hospital and realize some of those cost savings. Now, the challenge with that in the long run is that we're going to ultimately need those hospital dollars to build communities. So right now we're using some of these dollars for one-time cuts, but ultimately as we continue to move down the path and head towards 2015, we are desperately going to need those hospital dollars to continue to build communities. If we're going to be successful, once the settlement agreement dollars go away, if we are going to have a viable, strong, community-based behavioral health system, those hospital dollars have to follow our population out into the community. So what we've done here is some of these services that have been done in the hospitals, and we've realized some of those costs. We've used that for some of that money. And then on the next slide, slide number 11, again, these are all budget neutral issues. It's making sure that our budgets are in line with what we're doing. It's, in essence, truing up our dollars and making sure that they're tied to programs. What it helps us do is hold our internal people more accountable, and we can then track our dollars more wisely. We can see exactly from a program by program basis where we're spending our dollars. So it's really just shoring up and making sure that the budget allocation is going into the right place. And again, these are budget neutral issues. One of the best examples for that is on page 12, where we talk about forensic services and CNA mental health. We had a program out in at the Pathways Community Service Board that serves youth on a forensic unit. That unit had been tied to the child and adolescent budget. That budget really needed to fall under the forensic budget because that's what it is. So we made that switch. Again, it's budget neutral. There's no impact to us. And then finally, on page number 13, we did have, and this I know was a very large topic of conversation last year, we had upper payment limit money. What that is it's money, one-time federal funds that come into the state hospital system based on your cost expenditures for running those units. As we have downsized those units, the dollars, you cannot just do away with the costs associated with that until those units are totally closed. So you still had costs associated with that. So the one-time upper payment limit money that came in, we were able to receive. And what we did so that we would not have to impact the clients that we serve, we used that as part of our budget reduction, part of our 3% budget reduction. And so you can see that on page number 13. And then again, the other thing that we're doing, we feel very strongly that one of our biggest responsibilities is making sure that we provide efficient and effective treatment with all of the services that we deliver. And in the state hospital system, as we have downsized some of those units, we are indeed downsizing staff as well. And so you can see that personal services and contracted services. The other thing that I know was a topic of discussion last year was the Dr. Singh contract. And you can see that that contract has been greatly reduced. I do want to address that very quickly because it was one of the first things when I started that was kind of a bone of contention. What are we going to do with the Dr. Singh contract? The one thing that I want to remind everybody, Dr. Singh's contract is for a team of about 20 people. It's not an individual person. So it's a team of about 20 million people, or 20 people. The other issue is, as I spoke to our medical director, Dr. Risby, and Dr. Lee, on the value of the Dr. Singh contract, the one thing that we desperately needed to do was ensure that we had policies and practices in place that meet the CRIPA settlement agreement. That's the role that Dr. Singh has been playing with us. He's been helping shape policies and practices and then making certain that we're following those policies and practices so that when the Department of Justice comes in for their reviews, all of our staff have a very, very intimate understanding of the work that they're supposed to be doing. Once CRIPA goes away, and as you can see, it's down to $1.5 million, the ultimate goal after next fiscal year will be that we will finish up the contract with Dr. Singh. So that is not going to be an ongoing contract. But we do desperately need his continued work as we finish up the CRIPA lawsuit. And again, you can see one of the two agencies that we administratively are tied to our organization, the Georgia Council on Developmental Disabilities. They certainly were impacted a little bit, and the Sexual Offender Review Board, they were impacted as well. Not to a great amount of money, but they were impacted as well. So you can see that overall, we did meet our 3% cut. We did so without impacting the clients that we serve. We're very proud of that. And I think that as we move forward, we certainly need to continue to look at our hospitals and make sure that we're running those as efficiently and effectively as we possibly can. I was told of stories many years ago when you'd close one unit, people would literally kind of jump the fence to get over to the next unit that wasn't closed. So a unit that may have had 100 people on it at one point all of a sudden grew to about 200. We're looking at those situations now very, very closely and making sure that both the department and you will be pleased with the work that we're doing in that regard. The other big challenge that we have is as the Medicaid rosters have grown, the numbers of dollars that are coming into our agency to match those Medicaid rates have been very, very, very challenging. And so ultimately we're going to need to look at that situation. And then again, the cuts that we're talking about that we were able to gain from the upper payment limit dollars, those are one-time cuts. After 2014, it is going to be very, very, very difficult for us to maintain these cuts if we only start relying on the hospital expenditures. We're going to need to seriously look at that starting in 2014 and 2015. So we can certainly answer any questions, and again, I may call on some of our team here to help us. I also want to recognize, again, I joked a little bit in the morning, or when I started, the work with the other commissioners. I think we're really pleased that we're starting to do things together with Commissioner Cook and Reese and Owens and Fitzgerald and Karina. I think we have an opportunity of a lifetime right now to do some things. We're working with corrections, for instance, on a reentry program for people who are leaving the correctional system, and how does our department support those people? To me, that's when you start realizing the real benefits of 2 departments working together, and 3 departments and 4 departments. We're talking pretty regularly. We're starting to share resources in regards to ways of developing programs and opportunities to work together. The Behavioral Health Coordinating Council, Chair Dempsey, that I think you've been such an instrumental part on, is starting to take hold, and I'm very, very, again, honored to be here, pleased to be here, and can answer any questions that you may have.
Thank you so much. That was great. Does the committee have any questions? That was a great presentation.
Thank you very much.
Thank you so much. It was really good. And if there are some that come as we prepare this, we'll bring them to you, but also there'll be time to look at 2014 and sort of carefully go into that.
Thank you. And I want to
again.
thank my team for being here today, and they were prepared for anything. So,
It's always good to be
their brains behind
prepared.
the
Thank you
operation.
so much. That was great. So we will move next into the Department of Human Services. Commissioner Reese, if you are here. Keep sipping tea and try not to breathe on you. Good afternoon, Commissioner.
Good afternoon.
Whenever
Chair.
you are ready, we
Okay.
are for you.
Good afternoon, Madam Chair, members of the committee. My name is Clyde Reese. I'm here on behalf of the Department of Human Services to go over our fiscal year 13 amended budget. And Madam Chair, I'll do this as you prefer. I could go back over some of the presentation I presented to the Joint Committee with mission and values and some of our challenges and some of the things we're doing, or I could just go through the 13 tracking sheet with the changes where we took the reductions. So I'll do whatever you prefer.
I think the tracking sheet would be well, and as you touch on challenges, make sure that we're well aware of them.
Okay,
too.
very good.
Yes,
Well, let
thank
me
you.
start out then. I'm using your tracking sheet. We're in section 27. And so you'll see at the beginning we start out for fiscal year 13 amended, and I'm just going to talk about state funds, not federal funds unless you have specific questions. But we start out with a base of around $491.7 million. That is $485.5 of general state funds, and then a little over $6 million of tobacco settlement money. I'm just going to go over the areas where we actually have changes and cuts or adjustments for fiscal year 13 amended. So we'll go down to line 27.3, and that's the child care licensing program. We have 1.58 million base budget. We're going to reduce one vacant surveyor position as a reduction, and then we end up with 1534. Skip down to child support services, 27.5. We start out at around 24.6 million. We're going to take some reductions in travel, which will be 145,000. The number to your right is the total, because we have a 66%, 34% match in child support. And so when we cut the 145, it results in that larger number for the federal cut. 27.52, we're going to have a reduction of 35 vacant positions, and this will result in 526,000 savings, which will be about a 1.549 million reduction. So we end up in child support with about 23.833 million. We move down to departmental administration. This is line number 27.9 on your sheet. We start out here with a little over 37 million. We're going to take a adjustment with regard to reduction in property liability premiums for the state. We're going to have an adjustment for telecommunications expenses. That's on AT&T, IBM, GETS. We're going to reduce funds for personal services. We're going to reduce funds for operating expenses. We're going to have a reduction in contractual services for telecommunications technology, and we're going to have a reduction for computer services, and that will add up to a little over 2 million, and we come out with 34.877 million in administration. So we're taking a good measure of the cut for 13 amended in that program. Line 27.10, elder abuse investigations and prevention. We're going to start out with 14,212,000. We're going to reduce 2 family service positions, family service workers, and that will leave us with 14.156 million in that program. Next, 27.11, elder community living services. We start out with 71.786 million. As I explained to the Joint Committee, we administer the Community Care Services Program, which is part of the overall Medicaid waiver, along with SOURCE, but it is looked at on the federal level by CMS as one large Medicaid waiver, and there is a cap on the amount or number of enrollees in the program. We reached that cap before the end of the year, and so we're not able to continue to provide services or enroll people in the CCSP waiver. So we were able to take a reduction there of around 2.638 million. We will not have that same reduction in 14, but we were able to use it as a cut in 13 amended. So we end up there with 69.148 million. I go down to out-of-home care, 27.17. We start out there with 67.637 million. We're going to have a reduction in general operating expenses of 50,000, which will result in 67,587 for that program. That's the extent of our cuts and reductions in our basic programs in DHS for 13 amended. I'm going to go quickly over 2 of our attached agencies, and Mr. Greg Schmieg, Executive Director of the Georgia Vocational Rehabilitation Agency, who are also attached to us. He's here to present his budget figures and to also answer any questions, so I'll defer to him on that. The Council on Aging, if you go over to line 27.21, they start out with a base of 205,127. We're going to have a reduction in funds for personal services, which is proposed to meet the cut this year of $6,154, which would leave a budget of $198,973. Family Connection, line 27.22. We start out there with a little over 9 million. We're going to have a reduction in state funds. We're going to replace some state funds with federal funds to the tune of 451,000, and the elimination of 2 vacant administrative positions at $76,040, which will put them for 13 amended at around $8.5 million. And as I said, I'll defer to Mr. Sneed for the GVRA. And those are our cuts for 13 amended. Those are our reductions. Our other programs are essentially remaining the same, and I'd be happy to answer any questions, and I have senior staff here to answer those questions also.
Thank you, Commissioner. Are there any questions from the committee? You've done an excellent job. I'll tell you, I think we all realize how very close and tight these dollars are, so
Yes.
there's not a lot to question. I appreciate the accountability that you're giving us today.
Thank you very much, and we're available to you whenever you need us.
Thank you
Thank you.
so much. And Director Greg Schmee will come up and fill us in on this new attached agency.
Madam Chair, members of the committee, my name is Greg Schmee. I'm the Executive Director of the Georgia Vocational Rehabilitation Agency. We prepared a little 5-page handout for you, but let me start with the tracking sheet just so we stay on that line. So if you look at line 2724, Georgia Vocational Rehabilitation Agency, Departmental Administration, the reduction is in personnel services, reduction in force. Then if you look down to line 27.27, Roosevelt Warm Springs Institute, it's actually a transfer of funds from the vocational rehabilitation over to Warm Springs to align better with the budget. Then moving down to line 2728, the Georgia Vocational Rehabilitation Agency Vocational Rehabilitation Program. That's the transfer of the 145 to Warm Springs, as well as a further reduction in personnel services of $390,000. Before I go into the little handout, is there any questions about the tracking sheet information that I can answer for you?
Are there any questions from the committee at this point?
All right. The little document in front of you really just is to give you a little overview. Since we're a new agency, I thought it might be helpful for you to have a little background. I'm not going to read it to you, but on the first page inside, you'll see that it's, we went into existence July 1st as a result of House Bill 1146, signed into law in April by Governor Deal. Basically, the agency, GVRA, has 5 programs, the largest of which is the State Vocational Rehabilitation Program, which receives both state and federal funding. Disability Adjudication Services, which is 100% federally funded. The Roosevelt Warm Springs Institute. Then we have 2 small programs, the Business Enterprise Program and Georgia Industries for the Blind. Georgia Industries for the Blind, I might add, receives no state or federal funding. But if you turn to really the next page, probably the things that you're going to get the most calls or questions about is that we do have 5 federal grants that come through the U.S. Department of Education, through the federal agency, the Rehab Services Administration, to the state vocational rehab program in Georgia. These are formula grants, the largest of which is the VR, or the Vocational Rehabilitation Grant, and it's a matching grant. And so you'll see there on the page the match ratio is 21.3% state funds to 78.7% federal funds. For this current federal fiscal year of 2013, the federal potential is about $104 million. Our current state VR appropriation is a little over $13 million. Of that $13 million, about $2 million is in contracts that are not matchable, which really makes our matchable amount of state funds in that program about $11 million. So if you apply those match percentages out of that 104, currently in Georgia, we're only able to draw down about $48 million in federal funds. To fully match the federal grant, it would take about $27 million in state money to match the full federal grant. If you turn to the next page, and I'll be certainly happy to entertain any questions as I go through this, but the next page kind of shows you the situation that we're currently in for FY13. We pretty much have 2 line items in that program budget that directly fund services for clients. One is a contracts budget in which we contract with service providers all over the state, your Easter Seals, Goodwill, small providers in all parts of the state. And you can see the rate at how we have spent services on clients. And then the bottom half of that is case services, and that's when an individual vocational counselor somewhere in the state authorizes a service for an individual client, whatever that service may be, whether it's a hearing aid, tuition for college, work adjustment training, and you can kind of see that. So really our task at hand for this year is making sure that we make the money that we do have in this FY13 stretch until June 30th. And then the last page I'd like to just draw to your attention for future thinking, really, is that's kind of the situation that Georgia finds itself in. If you look at the year 2000, the VR program received approximately $30 million in state appropriations, and that has now gone down to $13 million. And in the same year of 2000, there was 29,431 cases served by that program, and in FY12 they served 41,551. So as the volume of cases served is going up, the state appropriations is going down. Is there any questions I can answer for any of you? Yes, ma'am.
Just let me get your numbers there.
Looking at that last chart,
Uh-huh.
how much money do you really need to serve the 41,551?
That's a very good question. It's hard to predict because there is no such thing as an average case. For example, like I mentioned, one case may require only a hearing aid to become employable. Another may be a vocational goal that requires a college degree in which we're providing college tuition for 4 years. And truly, we should serve every individual Georgian with a disability based upon their unique needs. But all I can say is that to fully maximize that federal grant, we would need about $27 million to maximize that full match. Now, I'll tell you, one of the things that we have looked at is partnering with other state agencies. We've had some great conversations with certainly Commissioner Berry, Department of Behavioral Health, for clients that we mutually serve. We've had great conversations with Commissioner Owens, Department of Corrections. We've had conversations with the Department of Education to see if there's a way that we could leverage some of their state appropriations as match for our federal grant in the vocational rehab program, where we share common clients. Yes, ma'am.
In follow-up, you mentioned college education.
Yes, ma'am.
Does the Pell or the Hope Scholarship come into account with
It does. That would be considered a comparable benefit. So our reimbursement would certainly take the Hope or the Pell grant into consideration, and we would only pay above what the Hope or Pell does not cover.
to make it 100% of payment?
Well,
is
we're
that
trying to actually look at aligning our reimbursement along the Hope Scholarship guidelines, which would be about 84% of the total cost of tuition.
Okay, thank you.
You're welcome. Any other questions I could answer for the committee?
Anyone else? No, I know that this is still so new to
Yes,
many.
ma'am.
And I think that we are hearing in our districts, from some people and concerns about providers and just the changes that are taking
Yes, ma'am.
place. And so I think we all need to stay keenly aware of it, but I think there'll be more discussion as we sort of look at the 14.
And I will be happy to be available at any time. And you're absolutely right. As we are trying to stretch our dollars to make sure they last through June 30th, what is happening is that there are consumers who aren't being served, and so you will probably hear from your constituents, and there are providers who aren't getting referrals. So I expect it will probably get louder rather than quieter between now and June 30th. But my goal is to make sure that we are good stewards of the tax dollars and to make our money last to the best we can through June 30th.
Thank you so much.
My pleasure.
Appreciate it.
Thank you.
Y'all are doing a great job. Thanks to everybody that's here presenting. Let's see. Next, we have the Department of Labor, and we are just a little bit ahead of time, I think. I don't know if Commissioner Butler's here yet. Oh, great. Great. Happy members up here as we move faster, right? So, in the holding area? I'll try. Sure, you can make a call. Just leave them right there and we'll... afternoon, Commissioner. Thank you for being here. If you'd like to share whatever you would like to with us to start with.
Well, it's definitely won't take as long as it has in years past, so we can probably knock this out pretty quick. I'll go ahead and flash through the tracking sheet real quick and kind of just, then give you a quick overview, what is it we're going to do. You see under labor administration, the cuts in operating expense and also personnel services. And basically the same under workforce solutions. There will be an additional reduction for also basically personnel services. We're already working on a plan. Right now we've kind of got to the point now where our biggest impact on cuts is typically going to be personnel. However, we're also looking at other areas too. We're consolidating space and reevaluating rents throughout the state, a process we had tentatively started last year and then put on hold until after we figured out what buildings we were going to be in and not be in through all the different transitions, but that's back in process now. We've got several that we'd like to get out of, and we're trying to consolidate space in the building that we currently own here in downtown. So going forward, hopefully that we'll be able to realize some savings there. Some other cuts that are not necessarily highlighted here on this sheet, if you'll look under unemployment insurance, you'll see state dollars, $5.7 million right there. Just for your information, that's the money that's been set aside out of our state dollars that will go toward the interest payment that will be due next October. So that's also, consider that part of lost revenue as far as operations go too, because we can't use that money for salaries or operations either due to what it's been designated for. We've also lost a tremendous amount of federal funds over the last several years due to some change on the federal level, and we're kind of like you all right now. We're kind of waiting and seeing what goes on in Washington about some of the changes that they're going to be bringing down, and we'll probably have to make adjustments on that. So I'm not really here to ask for anything today, just letting you know that we're being good stewards of the money that we're getting. We're going to make the necessary cuts. We'll make it work. It's not going to be easy. We're trying to minimize the impact on services to people out there. We did have to close 5 career centers last year through consolidation efforts. A lot of that had to do with the fact is we were looking where our career centers were, and also the fact that we had personnel shortages and some others, and through combining some of those offices, at least we were able to get the offices that we had staffed up to proper levels. Now, that's not to say that we are fully staffed in all of our offices. There are still some significant problems in different offices because, for the most part, we've been on a hiring freeze. The only hiring we're doing right now is essential services, essential personnel, when those do come open. But we're also looking to shift more people out of the central office into our field offices because, quite frankly, that's where we need the most help.
Are there any questions from the committee? Would you like to take a minute since we've got a little extra time?
I didn't know if you had enough time to go through that right there.
Well, just anything you'd like to help us understand about it would be great.
Well, basically what I've got for you, we're going to start doing this every year, so that way, quite frankly, this is something that would have been really helpful for us back when I was sitting where you're sitting. When I was on industrial relations, if we had a briefing like this here, we'd had a better understanding where the trust fund stood through those years and any adjustments might have been made. So basically, this is an overview of where we are with the trust fund right now. You'll be happy to know that we have made significant strides toward getting that loan paid back to the federal government. We have gotten the balance down to $540 million. Our projections are that we will have the loan paid back by late fall of 2014. And the reason why that is such good news is obviously you don't want to owe money to anybody if you don't have to, but that'll negate the need for state dollars for the interest payment. It will also be somewhat of a windfall to Georgia businesses because they will, right after we get that loan paid back, they will get the feeder credits back, which they're having to pay extra federal unemployment tax right now due to the fact that we still owe money. And so that's going to be a good thing for Georgia businesses, and so I'm sure they would like to get all that money back in their coffers so they can use that to hire personnel in their own operations. So we don't have a whole lot of control over that except for the fact of just getting that loan paid back as quick as possible. As soon as we get the loan paid back, those feeder credits go back to our businesses.
I know we're moving pretty fast here, but are there any questions?
Well, and just so you know, if you see something in this book and you want an explanation, please just call our office, and we'll be happy to go over with you. I mean, we'll come over and sit down with you. It's a lot of information, probably more than you've ever wanted to know about the trust fund. But we tried to make it as complete as possible and as informative as possible, so that way that if you have any questions from your constituent, which you probably will, I know I handled one very angry constituent of a rep from up around Roswell this morning about their increase in their future tax. So it's it's something you're probably going to hear about, and so we want to give you this that way, give you something to be better informed about when they call you asking, well, why is our future going up? Well, if there's any, and honestly, if there's any of those constituents you would like for me to personally call, please pass those emails or phone messages on to me, and I'll be happy to make those calls for you.
Thank you so much.
Thank you, Chair. Thank you,
Appreciate you and your team being here today. So as we move along to Veteran Services, Commissioner Pete Wheeler and Assistant Commissioner Dan Holtz. We have a great presentation up here to hand out. Good afternoon.
Good afternoon. I'm Commissioner Pete Wheeler of the Department of Veteran Service, and we are very pleased to be here to discuss with you this afternoon the proposed changes to the 2013 appropriation for our department. While containing a 3.0% reduction overall state appropriation spending for our department in fiscal year, the governor recommended budget for 2013 contains the additional other funds related to the collection of the daily fees from residents of the War Veterans Home and redirects some funding to support additional positions for our Veterans Benefits Program. In addition, in the calendar year 2011, the last year, available data over $2,130 million in compensation and pension benefits was brought into Georgia's economy largely through efforts of our department. Assistance to veterans with their claims. During that year, we provided over 136,000 days of nursing home care at our veterans homes. For veterans homes. Finally, we maintain the graves of over 2,300 veterans and their family members at our cemeteries. Our Assistant Commissioner for Administration, Health, and Memorials, Mr. Dan Holtz, will provide the detailed information now for you, and if there are any questions, we'd be happy to try to answer them. Thank you so much for what you do for the citizens of Georgia each day. We appreciate you.
Thank you. It's always good to see you and hear from you. Thank you. Oh, that's great. Well, be careful. Thank you so much.
Madam Chairman, it's good to be here again and to see you all. Glad to see Representative Epps is with you now. We've had quite a few dealings together down in the Milledgeville area, and it's good to see his smiling face staring back at me. I gave you a copy of our presentation. I'm not going to go and spend a lot of time on our mission, vision, and values. They're there so that you can refresh yourselves as to a little bit more who we are and what we do and kind of how we do it. One of the key points Commissioner Wheeler usually points out is that in our Veterans Benefits area, anyone who wants to get a benefit from the VA has to know about it and has to apply for it. And that's what our primary focus is in our Veterans Benefits area. So skipping on over to page 5, it's a summarization page, and it does follow the tracking document. So It's just in a little slightly different format, but all the numbers are the same. And you can see that we started out with an adjusted state baseline of just over $20 million. And when you take the 3% reduction, actually it's 2.4 when you adjust for the telecommunication increases that were put in. It drops it down to just under $2 million in state funds for a total of $38,505,987 in total state, federal, and other funding. On page 6 is where the first input on the statewide common changes shows up, the telecommunications adjustment to our admin program. And of course that's the same adjustment, I guess, that just about everybody's gotten. On page 7, we had no changes to the cemeteries program, and so the figures that we started off with there are the same ones that we're ending up with after we go through this exercise on the amended budget. On page 8, the Augusta home, we're transferring a little over $98,000 into our Veterans Benefits program, and I'll talk more about what we're going to do with that when I get to the Veterans Benefit program. We've increased other funds by $149,000, and this is to recognize the residency fee that we're now charging to our veteran patients at both of our veterans homes, and that program starts tomorrow, and we'll talk just a little bit more about that in a moment. The number is a projection because we have no history. It's the first time we've ever done anything like this as far as these folks are concerned. And so in conjunction with OPB, we came up with a number that we think is a very conservative projection as to what we are going to get. In fact, we may even have lowballed it a little bit, but I'd rather be conservative and not have a number in there that we can't meet, because there is an offset in state dollars of a similar amount, and so we don't want to overshoot. And we of course reduced $251,282 that is part of the 3% reduction, but we took it out of the homes because our patient census at both homes has been lower than what we had anticipated. Unfortunately, we've run into a problem at both homes. As we're admitting new patients, we're losing current patients due to death and discharge, primarily death, and so it's we've been in a holding pattern for about the last 3 years. At the Milledgeville home over on page 9, it's a similar situation. We're increasing other funds by $142,000 and transferring a like amount out of state dollars into our Veterans Benefits program, and then reducing that program overall by $361,000, which is part of the 3% reduction. In Veterans Benefits, we also had a reduction in the property liability program and an increase in telecommunications. Both of those are reflected there. And then there was a transfer in of $241,020 in state funds as part of the internal redirection from the two state home programs. And this plus up in this program is going to fund 12 new field service officer positions around the state and 2 new claims and appeals officer positions at our claims and appeals division that's located with the VA's regional office over in Decatur. A reminder, as Commissioner Wheeler mentioned, last year $2.13 billion was brought into the economy of Georgia through VA compensation and pension. And our department was a major player in assisting those veterans in getting those benefits. And so the whole purpose of this exercise of getting these additional positions funded in the program is to help us be able to provide more assistance to more veterans to get the benefits to which they're entitled and they need to apply for. On page 11, there's a breakout shown of where we're going to put these positions. And just as a reminder, for those of you who were around when the fiscal 09 budget was first approved, we started with 10 new authorizations in that program. We were able to hire in 2 of them, and then the budget crunch hit, and we lost the other 8 due to the hiring freeze. Actually, the authorization stayed with us until January of 2011, when Governor Deal eliminated something in the neighborhood of 14,000 positions statewide, and so we lost our 8 positions as part of that effort. So we're wanting to put those positions back on the books and get those folks out in the field. We presently have one person at our VA Medical Center office in Augusta. That's going to go up to 2. We have 2 people in Athens, and that's going to go to 3. Columbus, we have 3 going to 4. St. Mary's, we have a person down there at the community-based clinic the VA operates in St. Mary's 1 day a week. And so that position or that slot is going to go to a full-time 5-day-a-week operation. Valdosta, we've got 2 folks. We're going to raise that to 3. In Thomasville, we have 1, and we're going to raise that to 2. And of course, then we're putting 2 new positions in at our Claims and Appeals Division. Those folks are, I think, the last number, Mike, I heard was, what, about 140 hearings that they're doing, about a quarter over there. So that, multiply that times 4. These are hearings that are conducted by the VA where veterans are coming in and saying, I think what you have awarded me is incorrect. I think I should be getting more. Here are my reasons why. We represent those folks. And that's what they're doing. And they have video hearings, they have face-to-face hearings, and it's an ongoing process. It's very busy. And our folks are really pushed and strapped because of the number of clients that we're representing. So these 2 additional positions are going to help us a lot over there. As you know, we've been getting new military missions into the state, particularly at Columbus. So we're recognizing those. Of course, the new mission down at St. Mary's at Kings Bay Navy, that population down there has gone up considerably. So we need to be able to take care of those folks. And we're seeing more and more people coming into Georgia through normal separations. Of course, returning servicemen and women from Iraq and Afghanistan. And we're projecting, as is the federal government, that with their reductions in the Department of Defense, that we're going to see more and more veterans coming into Georgia because they're going to be looking for jobs. They're no longer serving on active duty because their positions have been done away with. So we need to be able to take care of those folks. On page 12 is the last 6 of those positions. Currently, we have no field service office representation in Cobb or Gwinnett County. The 2 largest veteran populations in the state, as far as counties are concerned. In Fulton, we do have an office across the street in the Twin Towers, but that's downtown Atlanta. And we get a lot of complaints from folks who have to come in to downtown Atlanta because they're old, they don't like to drive in heavy traffic, and so on. The VA is opening up a community clinic out at the old Fort McPherson Clinic, and they have offered us space out there so that we can put a couple of folks into that location, and we'll be able to provide services out there. So that's where those 6 positions are going to go, is Southwest Fulton, Cobb, and Gwinnett, and we're working to get locations squared away on those as we speak. Also, the one in Gwinnett is going to have a little bit of a spillover into Hall County. The VA has a community-based outpatient clinic in Lawrenceville, and we already have 1 person in there, and they're getting ready to open their new and expanded community clinic at Oakwood, and we're going to have somebody in that location. We're still going to have an office in Gainesville, but we're going to have to work as to whether or not we have 1 person in Gainesville and 1 person in Oakwood, or exactly how we're going to play that out. But that's where we're headed. Just very quickly, on pages 13 and 14, I've got a little summary on where we are with the implementation of Act 658 of last year's General Assembly that established the daily fees for the 2 residence homes. The fee is currently set at $22.81, which is the value of the VA's aid and attendance benefit, which many of the veteran patients at these homes are eligible to receive, and we are assisting them in filing claims for that benefit if they haven't already started receiving it. That works out to $694 a month, or $8,328 a year. And I had the opportunity of attending a hearing that Representative Epps was conducting with a couple of other members of the General Assembly back last May. And one of the things that was pointed out at that hearing, and subsequently at two hearings that I conducted on the administrative rule, one in Milledgeville and one in Augusta, this rate, you know, it compared to what the cost is in a community nursing home of over $200 a day, you know, this is very, very reasonable, very nominal. And I've had the opportunity of pointing this out to folks on a repeated basis, as did Representative Epps when he was in Milledgeville, and I really appreciate the fact that he was able to make that meeting. The intent is to be able to collect that aid and attendance benefit. You can't get it, though, directly because it's a federal benefit. It's paid directly to the veteran, and the only way that you can go and get it is to have a fee established, and the veteran can use the proceeds from the aid and attendance benefit to pay that fee. That's just the way it works, and so that's the reason the legislation had to be set up the way it was. So we've gone, I think, the extra mile to make sure that what we're doing with the value of that is as low as we can keep it. We're using the federal poverty guidelines as a starting point for those who are wanting to request a waiver, and I'll talk a little bit more about that in just a moment as to how many of those we've had. And that seems to be working very well so far. As I mentioned, we're starting the collections actually tomorrow. I think all the bills have gone out the last couple of days. We held off. We were going to do it initially the 1st of January, but we held off because of we needed to hire staff, get people trained. The holidays got into our way, and we wanted to make sure we did this clean and didn't have any hiccups if we could possibly avoid them. So that's the reason we picked the February the 1st as the start date. On slide 15, you can see we had 6 people who were determined to be eligible because they fell below the federal poverty guidelines. All 6 of them requested waivers, and all 6 of their waiver requests were determined to meet the criteria for substantial hardship, and all of them were granted. This is a number that actually, quite frankly, to me was a little bit low. I was surprised that we didn't have more than that, but that's what it worked out to be. So I'll entertain questions.
Thank you. Any questions from the committee? Yes, just a minute. Representative Epps.
No, more of a comment than a question. Thank you, sir. For looking after those that have mean so much to this state. You did an exceptional job that day in Milledgeville and responded to the concerns. You know, what was happening was an entirely unexpected ordeal that these people were going through. They knew nothing of it. You handled it gracefully, and I just applaud you and General Wheeler for what you do for our veterans, and fully support you in your efforts.
Well, we thank you, sir. And again, I want to thank you and Senator Grant and Representative Kidd for coming down in May. Just a little anecdote. Because folks in Milledgeville tend to be a little bit more on the cantankerous end of the line as opposed to what we normally see over in Augusta. Surprise! When you guys came in May and talked to them about why the law, that really took the wind out of a lot of people's concerns and helped that situation a lot. So when I got to Milledgeville on the 4th of October, when you were back there in the audience, I believe, and what I was talking about was the rule at that point in time, that's all I had to talk about. I went to Augusta the next day. I had to talk about the legislation because none of the legislators from the Augusta area had done what you folks had done in Milledgeville. And so I was talking about the legislation as well as the rule. I had a ball. I was never so glad to get home that night that you can believe.
Thank you. Representative Henson.
To come to, such as Sloppy Floyd building.
Yes, ma'am.
how handicap accessible is that in terms of proximity for parking? I mean, I don't know if you had a handicap parking spot or a sticker or you had anything else, how far away are you still having to park?
Well, a lot depends on which parking lot you pick. But if you get into the Pete Hackney lot and you have a handicap sticker, hopefully you're going to find a handicap spot in that particular lot. Now, depending on when you get there, you know, they maybe get few and far between, because we have, quite frankly, a lot of people who are handicapped employees who use those slots, both in the Butler building and in the Hackney building. But there are handicap spots there, and many times in the Hackney building, they're more available than there are in the Butler building. The people need to go, of course, to the 5th floor, take it down to the 3rd, or go across the bridge to get across the railroad track, then take the elevator down to the 3rd floor, cross the bridge into the building, and right when you come in the building there is an elevator on the right that takes you up to the balcony, and we're just across on the far side of the balcony. So it's fairly easy to get to. The biggest problem probably is finding a quote-unquote handicap spot.
So those doors are not kept locked from the Pete Hackney?
No.
Okay.
Except on nights and weekends, but our offices are open from 8 to 4:30, so you know, people shouldn't be coming in there to see
I
our
just
folks.
wanted to know, I mean,
Yeah.
you know, like the Capitol
Right.
is another matter.
Yeah,
you know,
that is
too.
an issue that we are very attuned to, is compliance with the Americans with Disabilities Act. Every one of our offices that we have, we go to great lengths to make sure that those are handicap accessible. We're talking to a location right now, and it looked real nice until it got up to the door going into the building. I mean, there was a ramp and there was everything, but there was about a 6-inch step up that, and we just said, hey, this is not handicap accessible. We can't use this. We've got veterans with wheelchairs.
One other question following up on the handicap accessibility with regard to number 2. There's no place that someone could drop a person off where they could then go in. I mean, like, you know, as at a hospital or anything else, you can drop them off at the door.
You're talking about strictly on the Floyd building now?
Yeah.
Yes, there is. Actually, there is on both sides.
Okay.
There's an elevator. That elevator that I mentioned, that's actually it's on the east side of the building. There's also one on the west side of the building that goes in there, and you can get on that elevator, and it'll take you straight up to the balcony.
I've never driven around it. I mean, in the sense of knowing where those are.
It's
Thank
right
you.
there on either end by the MARTA entrance.
Okay, thank you.
I just wanted to echo what Representative Epp said about the way that you handle the situation, particularly with the veterans and that daily, per diem, I guess, is what we're talking about. And to tell you how much I appreciate what you do for our veterans. I've never been to the Augusta home, but the one in Milledgeville is top notch. It's well run, and I think our veterans are well cared for there. And the other thing I was wondering, I know that you said the hospital census or the home census has not varied much. Is that correct?
Yes, sir.
All right, but you do have more beds.
Yes, we have a capacity at Augusta of 188 that we can put in there. Right now we're running a census of about 162. At Milledgeville, we've got a capacity of actually 350, but 80 of those beds right now are closed out in the Vinson building because the low census, and also we've got a water line problem in that building that's got to be taken care of. So there's 270 beds that are potentially available, and we've got a census of 230.
All right, but do you do anything basically to alert veterans to the fact that those beds are available if they are having to get care elsewhere?
Yes, sir. Both homes do an active marketing program, and I think probably, it works reasonably well. The problem that is, I think, inherent in the fact that we've got 2 homes, one's in Augusta, one's in Milledgeville. If you've got somebody that's living down in the Golden Isles area and they don't want to have their loved one up in Augusta, that becomes a problem for them. And the same thing is true if they're in southwest Georgia or northwest Georgia. Sometimes distances do get in the way, but the facilities do market their capabilities primarily through veteran service organizations, the American Legion, VFW, DAV. But we encourage the home folks as well as our field service offices to talk up the fact that the homes are there and that they are available and that it is a very low-cost benefit to the veterans of Georgia.
It is a low-cost benefit, and again, thank you so much for what you do for our veterans.
Anyone else? Thank you so much
Thank you.
for bringing this information to us. It's always good to see y'all, and we'll look forward to seeing you again soon when we begin to work on the 2014 budget.
Thank you, ma'am.
Thank you. And we'll move to our last speakers for today, representing the Governor's Office of Children and Families, the Executive Director, Katie Jo Ballard.
Good afternoon, Chairman Dempsey, committee members. I have the pleasure of going last, so hopefully this won't put y'all to sleep. Hopefully I'll keep y'all awake. But the Governor's Office for Children and Families was created in 2008 from the combination of the Children and Youth Coordinating Council and the Children's Trust Fund Commission. We have 4 divisions: the Division of Juvenile Justice, which does diversion programming to keep children out of detention centers. And we also fund drug courts through this program for juveniles. We have the Youth Development Division, which focuses on after-school programming, abstinence education, as well as the commercial sexual exploitation of children. We also have the Child Abuse and Neglect program, which focuses on child abuse and neglect prevention and home visitation. And lastly, we have the Family Violence Division, which funds the sexual assault centers and domestic violence centers across the state. And I've read over the amended budget from the Governor and have complied with the changes he has recommended. Item 1, which is also 26.5.1 on your tracking sheet, reflects the changes in the telecommunication expenses. Item 2 is 26.5.2, and this is to recognize the Preventative Health and Human Services Block Grant for the Sexual Assault Centers. We're currently receiving this through an MOU with the Department of Public Health. This is a larger grant that they get, and the federal government requires that they give a percentage of that directly to the sexual assault centers, which we add to the state dollars that we give to them as well. Item 3 is 26.5.3, and this is our 3% cut, which will come out of our community strategy grants. And we worked with our community strategy grants this year to reduce their administrative costs, and we were able to realize the savings this way. So there was no loss in numbers served or community quality of programming. Do you have any questions?
Representative Hanson.
Yes, I'm asking all the questions today. Thank you. With regard to the $200,000 in funding, how's that being used?
That's directly divided up evenly across our sexual assault centers that are funded.
Okay, I have a few other questions. You have a 10% cap on administrative expenses, or you're proposing it?
That's something that we're working towards, is yes, reducing our administrative costs for all of our direct service grantees.
I heard that, but are you including things such as rent and mortgage and all of that under administrative?
That depends on what you're talking about. If it's for administrative purposes, yes, but if it's for direct service such as shelter, then no, ma'am.
Isn't a roof and all of that, I mean, a mortgage or rent is actually for the physical building, isn't it?
Yes, ma'am.
So therefore, the cost of the physical building is generally in the rent or in the mortgage, isn't it? So how could that be considered an administrative expense and be held to the 10%? I think is my real question. Because to me, administrative expense is generally in personnel. and yet you're putting it into a physical building and taking away from personnel, which means that we're not going to have the personnel to run these facilities. I have a great concern about that. I mean, I hear from all these shelters, I hear from the different areas how underfunded they are, how they're in fear of closing and everything. And yet, looking at your budget when you're putting the cap, the administrative cost on the actual physical structure, I have some grave, grave concerns. And I'm using physical structure in the same sense as rent or mortgage. And, I hope that maybe you can look at that differently and put the rent or mortgage into the physical structure as opposed to into administrative costs. I also have one other. You currently have a rule or requirement that these shelters must have 24-hour awake staff?
Yes, ma'am.
Could you give us the reason for that, please?
Yes, ma'am. They have to maintain a 24-hour hotline as well as 24-hour intake for clients. We got many concerns that clients were leaving and being locked out at night and having to knock on the door for over an hour to wake someone up, hotline calls not being answered because the staff were asleep. So this is something that I think is pertinent to the services they provide.
How much has that added to the budget? I mean, because for some of the shelters, is that making it a very, very difficult thing for them to have the budget? I understand it, but I mean...
This is something that the Department of Human Services had tried to move things towards, so most of the shelters had already complied with this. For some of the shelters, I do think it presented a financial struggle for them. Yes.
It did in the rural areas, didn't it?
I know one shelter in particular that we heard from. Other than that, I have not heard from other shelters. Yes, ma'am.
And is there a lot of, have we had a lot of situations where people are locked out of something else? Because I don't know. Speaking for myself, I know if I heard a telephone ring, or if I heard a doorbell ringing, I'd be up and alert probably within 30 seconds. So the idea of someone being able to sleep through an hour banging on the door, is there not a doorbell or something that could have been implemented in lieu of, basically what you've done is added an additional staff person with that requirement.
I think that people have restructured this in several different ways, not adding on additional, but changing it to shift work or covering it with certified volunteers. There are many different ways besides adding on a personnel.
Okay, but when we go over the 2014 budget, we can talk further about the administrative expenses and the issue of mortgages and rent and buildings.
I'd be happy to.
Thank you very much.
Are there any other questions from the committee? Okay, thank you so much for being here. If any more arise, we'll be in touch with you, and I think we may have some more as we go into the 14 budget for sure.
Yes, ma'am.
So
thank you.
Thank you so much. Do I hear a motion to adjourn? Thank you. We are adjourned, and thank y'all for being here today.